Hi, I'm Danny Aronson, Tune's co-founder and CEO. Tune is the hearing health benefit, allowing employers to add comprehensive hearing benefits to their employees, just like dental and vision. I'm very pleased today to be joined by Dr. Heather Malyuk, Tune's Head of Audiology, and Dr. Walter, Tune's Head of Vestibular Audiology. Great to see you both. Thanks for joining me.
Good to see you.
Leo, I'd like to start with a very simple question.
Mhm.
What is vestibular audiology? What does a vestibular audiologist do, and how is balance kind of connected to hearing?
Absolutely. So, vestibular audiology is the practice of audiology that focuses on not the hearing part of the ear, but the other five end organs, which are the balance part of the ear. So, what it really is balance is three things. So, you've got your eyes, which tell you where things are, your proprioception, which is your body telling you where you are in space. So if you're sitting down, your legs are against the chair and they're sending a signal. We're sitting down, we're stable, we don't need any extra help, really. And then your ear is the other piece of that. And you need two of the three to be in balance. So thinking of it kind of like a tripod, if you have just one leg down, it's not as stable. Two legs, okay, it's a little better. And then three legs, you're really in great shape with a tripod. So vestibular audiology is really the focus of making sure that people have a safe access to navigate their environment. So what we try to do in practice of vestibular audiology is identify if the patient is able to navigate well, or if there's some kind of issue or disruption in that vestibular system that's making them a little unsafe, that's not giving them the confidence to navigate their environment, or that may be putting them at risk for a fall or an injury of some kind. So as you're practicing vestibular audiology, you're putting all the pieces together of their life to make sure that they are safe to navigate their way throughout the world.
That's amazing. Just another question, then Heather, I'll bring it over to you. So what you're saying is, and what I've seen and what we've kind of talked about in the past, is that even somebody with mild or even a moderate hearing loss is more susceptible or more at risk of having a slip and fall. Can you speak to that a little bit?
Yeah, so as far as the hearing loss piece of that goes, there is some evidence that shows that if you do have a greater loss of hearing, there's a chance you have a greater loss of balance. So even though you may feel very stable, at times it might be best if you wake up and you feel that things aren't quite right and that lingers for a few days, your risk of fall jumps exponentially as you let that go, because you are no longer relying on all the senses you need to make sure that you're safe in your environment. So at that time, you'd probably want to get checked out. It might not be the ear, maybe your vision actually needs checked out, but vestibular audiology is a great place to start because we can help you put those pieces together to make sure you're in good shape.
Awesome.
Absolutely. I want to ask you a question,
Yeah.
which is vestibular care just for the geriatric population?
Oh, absolutely not. No, it definitely isn't. At any time in life, you can have a vestibular disruption. In childhood, we see it often through benign proximal vertigo, which sometimes can happen when a kid just is overstimulated or if they have some kind of issue in the migraine realm. And, I would argue it's most important in those developmental years to get the help you need so that you can make your long-term balance extremely stable. Because as you get older, if you don't correct those things, early in life, in those teen years, through those 20s, midlife, and later, again, the risk of fall or injury really jumps up. So we want to make sure you have a great base, and it doesn't matter what time of life it's happening at. Oftentimes we see, 20s and 30s, you'll start to notice a lot of migraine issues. In those 40s and 50s, you might start to see benign proximal positional vertigo, which is where, the room actually spins on you. And that can happen earlier in life too. But at those critical years, 40 and 50, that's when it really expands. So yeah, it's not just for the geriatric, not even a little bit. You've got to make sure that you're stable all through life, and the more you build on it, the better you'll be long term.
So that kind of goes into another question I have, which is, you mentioned vertigo. And of course, we think of individuals who have vertigo as needing help, obviously. So say something debilitating. But could you explain why individuals who even just perceive a mild or minor balance issue should take advantage of a benefit like this? And I kind of goes into what you were just saying, I think, where they're
Yeah,
trying to take care of it early to prevent issues later on. Is that still the case?
absolutely. So let's just take like a workplace example. If you have some just mild imbalance, if you work in a dynamic environment, maybe a construction site, maybe in a warehouse where things are always changing and moving around, you need to know where your feet are falling. It's critical for the project. It's critical for your health. It's critical to make sure that the everything in the project remains on time. And your injury out of that draws the entire project back. So we need to make sure that if you're feeling a little hindered, that you get the help you need so that we can give you the tools, such as, maybe we need to expand the lighting in these places to make sure that you have a deficiency. Maybe we talk and we realize that, your vision isn't that great, but it's a whole lot better when the lights are bright. And so we need to figure out, is that the way that we need to help you? Or is it perhaps a different thing, like you actually have an imbalance that's hindering your gait and your walking? Maybe you need to see a physical therapist, but we can help you find those answers and get the help you need so that we don't have any drawbacks. And in your daily life, you're not hindered. You can pick up your kids, your grandkids. You can go play the sports you want to play or do the activities you want to. We don't want you to have to think, oh, I might get injured. Oh, I'm not feeling great. I can't go play those things. I can't go do those things. We want you to access your life with great ability to thrive.
Absolutely. So on that same note, do you have any examples of someone who has increased their quality of life and maybe gone back to something that they used to love that they hadn't been able to do for a while?
Yeah, absolutely. So, about a few months ago, I was working with this woman, and she was referred to me by a friend. She was in another state, so I was just helping her via telephone. And she was telling me that she was having benign proximal positional vertigo, and that is where your eyes will move without volunteer. Like you don't have any choice in this matter. It's when your eyes are moving, they're involuntarily moving. So she was feeling the sensation of spinning. That is vertigo. And so she had right posterior canal benign proximal positional vertigo. I say that very specifically because there's a treatment that is very specific to cure that. So I walked her through these maneuvers. I gave her another online resource so she could see it visually. And we were able to get her back to surgery because she was that, like, within that week entering into her training to be a surgeon. She'd been doing it for a while, but it was her true residency. So she was going into the residency and we got her back. And she has young kids, so she was able to pick them up because that was a trigger previously when you bend your head down. And she was doing that without issue by the end of the week of just doing these simple maneuvers. And then about 2 weeks ago, one of my friends was having a lot of swimmy feeling, and these issues would last. And swimmy, kind of like floaty, things were not quite stable. She did not have true vertigo, but she was having an imbalance. So I spoke with her. I used the questionnaire that we actually use, which is the dizziness symptom profile. And through that, we kind of looked at what it most likely is. Talking to her, I realized it's probably this, and we found that it was vestibular migraine. So what did we do? We got her on some magnesium. She worked with her primary care physician to get another migraine med. And then she was able to get back into life. And she holds a couple jobs. She's working for the WHO, and she's also a full-time mom with a special needs kid. And then she also works for a newborn company as well. So working with her, we were able to get her back. Her energy level was better, and rest was also recommended because she's stretched pretty thin. But rest is a big deal when it comes to balance, and we were able to get her back to where she's functioning again, feeling much better, and was able to get a little break in there.
I love that. I think that people so often don't even know what an audiologist is, let alone a vestibular
Yeah,
audiologist, and the importance of the triage aspect, but also what you keep touching on is really how accessible and often, not always, but often kind of easy it is to get help,
oh yeah,
and to improve and to start living your life again, doing better at your work, all kinds of things.
yeah.
And I think someone listening to this, that would be maybe the most shocking thing is like, oh, wow, I can speak with someone and get a triage and actually they know what's going on with me and we can do something about it. I'm sure someone's mind is being blown right now listening to this, someone who's dealing with something. Question, again, thinking from the perspective of someone who doesn't know audiology. If they see someone like you, if
Yeah.
we have an appointment and you say, okay, we're going to do some therapy exercises, what does that look like? Do they do that at home? Do they have to go somewhere? Walk me through something. Of course, everyone's different, and I understand that, and I think a listener here would understand that. But give me an example.
Sure. So let's just take the first example I had for the patient who had positional vertigo. Those are just very simple at-home exercises that you can do. If you absolutely need hands-on help, maybe you don't move as great, maybe you have some neck issues, you might go see a physical therapist or an audiologist that's close by that's trained in this kind of treatment, and they'd be able to help you. And that is usually one, maybe two visits at most. And then let's say you had some kind of ear injury, a little more dramatic, like a neuronitis, where it attacked the vestibular system and kind of took it out. You'd probably want to do a little more than just a positional maneuver. We'd need you to walk through some, you could do at home maneuvers, and we do have a guide for that. But we would also encourage you to see a physical therapist trained in vestibular rehab, and they would be able to walk you through those. That might be a 3-5 visit, depending on how much need you have. Typically, if you're doing the exercises consistently, most people probably it's about a month to 3 months at the latest where you're fully recovered, where you feel 100% or close to 100%, where you're able to just get right back into activity. You can do all of these at home through our guide. They are vestibular rehab therapy. They've been used for decades, and we've been updating them, and they look pretty easy to follow. We can also give you follow-up visits if you need to, and we can guide you through those exercises. So if you need an in-person, that's understandable, but we're also here as a resource for you to walk you through each exercise and to make sure that you're making the progress that you need.
That's awesome. That's so great. And I want to take my patient hat off a second
Yeah.
and
Yeah.
put on my employer hat and say, okay, it's great that we're caring for people, right? But why would an employer care about this?
Yeah, I mean, an employer would definitely care about this because slips, trips, and falls are one of the major issues when it comes to workplace safety. It's one of the major financial drains on their system. And if we can make sure that the most dynamic variable, which is the person, has the largest amount of vestibular resources and balance resources, they're going to be able to navigate those tricky situations. And if we've got them to a level where they are safe and they feel confident, they're going to be walking in their work and place environment, doing their job as best they can because they're not hindered, as well as not making those mistakes or having those slips and falls because they can, one, identify the issues that they've been dealing with, and two, they have the balance they need to save themselves from a fall.
I think that's a great explanation. I want to just put some numbers on that. So slip and falls typically cost employers and on an annual basis, just in the US, $70 billion. And 30% of all worker comps claims, 30% are slip and fall related. Tuned is together, obviously, with Heather and Leo, has developed a completely unique system. I don't know of any other company that does this. It's part of the screening program that we have. So let's say that you're an employer and you've got Tuned for your employees. Your employees sign up to the Tuned platform. The first thing they go through is a screener, and the screener has two different types of hearing screeners, and it has a very robust questionnaire where we're looking for red flags. It's constructed in such a way that if there is a vestibular related red flag, then the employee will go through a specific questionnaire, which is around balance. And if the audiologist looks at that and says, okay, there's an issue here, that member or that employee will be referred specifically to a specialist like Leo, or specifically Leo, who will
Yeah.
sit down with them and say, I'm looking at your results. There's an issue here. let's see what we can do to help. And I love the fact that we can tie it in back to major medical, for example, for physical therapy, or if you need to go to your primary caregiver, whatever the case may be. We work very closely with these entities, and it's something that we do very well. But I think this idea of having employees going through an annual screener, just like you go to the dentist, just like you
Yeah.
go to the eye doctor every year, and if we catch something, then we can improve your quality of life, but we can also de-risk this for an employer. If you are in manufacturing, construction, aviation, transportation, any one of these relatively high noise level industries, and you have an employee that is having dizziness issues, but they're not aware of it, the risk that you are facing as an employer that employee will hurt himself or herself, or have a slip and fall, and that is going to be extremely costly, is high. And Tune helps de-risk that with this kind of new screening capability. So I think you guys have done an incredible job building that out.
Thanks.
Great.
And especially transportation. I mean, you're risking that employee and anyone else really on the road. So something to consider for sure.
It's an
100%.
aspect of safety that's not often considered. We think about regulation for safety with audiology being earplugs and annual hearing tests and things like that, but really this is equally important. I went through my questions.
That's
Annie, do you
awesome.
have any more questions?
No, I think it's a great primer. I encourage people to log on to the website, where we obviously have more information about this, and looking forward to sending a lot more members your way.